Thank you, viewers, for joining me again on Health Pavilion. Today on Health Pavilion, we'll be discussing another interesting topic, postpartum depression. With me in the studio is Reverend Father Anthony Efriye Amponsa. Father is from Catholic Archdiocese of Kumasi. He's also with Careers and Counseling Center, University of Ghana, Legon. Father, you are welcome to Health Pavilion.
Thank you.
How are you doing?
By grace, I'm fine.
Thank God. Father, what is postpartum depression?
Postpartum depression is one of the aspects of depression, but specifically for women who have given birth. It's a subclinical condition in mental health where the person in question feels so down, feels so low, feels so much of loss of energy that cannot be explained to any medication being taken or any circumstance around her. So the person is feeling so depressed, but there's nothing to explain why it must be.
Is it very common with women?
I should say it's 50-50. We can't really say it's so common, yet we can't say it's not. But it's prevalent. I mean, it's so widespread, and so many people have it.
So what causes that?
Well, biologically, postpartum depression happens when during pregnancy, there are some hormonal changes. And one of them, the estrogen in the human being, the woman, increases so high. Okay, and that is what will cause the person to have the breast milk being formed, the womb getting more elastic. It creates so much energy in the woman. And so the moment after childbirth, unfortunately for some women, the hormonal chemicals drop all of a sudden. Okay, so once it drops, then you have some form of emotional imbalance, some form of instability in the way your mood is, and that can cause postpartum depression. But that is just one aspect of it. That's the biological side of it. There could also be psychosocial side of it, where there were events around the person's pregnancy, and immediately after it, the person gets confused. That is, maybe the one who got her pregnant had issues about it, about who is the owner of the
acceptance of the pregnancy by the man.
Exactly. Or sometimes the opposite of it, that the person is so excited and the whole family is behind you, and so immediately after childbirth and all the excitement is dropped and everybody's gone home, then you realize that you're alone.
I thought giving birth or becoming pregnant is something everybody should be happy about. So if at a point everybody is happy, then they are all gone and you are alone, must that affect your level of thinking or your status of health?
The truth is, you see, in current or in modern world, there's this virtual world around you. You give birth and about 1,000 people are wishing you well on social media. But you yourself, you're alone, you see. And especially for royalties and people who are of high class, you know, everybody is expecting you to give birth and there's so much excitement about it and everything. But when you are going through the pains, you go through it alone.
So it's an individual thing.
Exactly. So you are left to be on your own, and so it can cause that. And some people also have the psychosocial issues where you are expecting a particular gender and it didn't happen. Okay, you're expecting a boy, you got a girl. You're expecting a girl, you got a boy. All these could trigger, you know, that you know, mood swing and that change in hormonal imbalance. So I would say that the causes are basically three. One is the drop of the hormonal chemicals inside of you that will regulate your mood on the negative side, the psychosocial aspect of it. And sometimes it could be a little bit genetic. So you could be born with it. There are people whose lineage is like that. Their balances are not too regulated, and so they at a point in time
go to the negative side of the mental.
Exactly.
So, Father, can you associate living alone as a pregnant woman associated with the social cause of postpartum depression?
Well, you could. You see, as I said, you are looking at a woman living alone, and all of a sudden you have extra work to do. The baby is crying, you have to attend to the baby, you have to clean, you have to do this, you have to do that. So all of a sudden your energy level is dropped, and it's also tailored into so much demands. Okay, so living alone right after childbirth can equally trigger. We can't say it will cause. It wouldn't cause postpartum depression,
Okay.
but it can either trigger or put you at a risk factor where you can experience them.
But we have a lot of single parents around without that condition, postpartum depression, or they don't report to the hospital, so we don't have the record for that.
Honestly, they may. However, they may not know.
That is postpartum depression.
Exactly. They may not know. The truth is that they may associate it with other conditions around them, and they may think it's normal. So I'm a single mother, I stay alone, I'm taking care of my baby as of that time. I have to do the cleaning, do the breastfeeding in the night, the baby is crying and everything. So you wake up and you are so stressed, you are so tired, you feel alone in the world. So you think that the sadness or the low mood you are having is normal because you have been working the whole day. So people give reasons why they think they are going through that. So they may be going through it, but they may not know. They may not know.
So what you are saying is postpartum depression associated with giving birth for the first time or multiple, like, for instance, a woman expecting the first child is predisposed to postpartum depression.
Well, we can't really scientifically prove that. But generally, research is beginning to realize that the lower the numbers of your childbirth, the higher the risk. Okay, so your first birth, you are so much excited and your hormones are so high and it drops. You have it. But if you have gone through before, you give first birth, second, third, you get used to it. And so if it's dropping, you are aware. You get it. So
you can differentiate the abnormal state of your mind from the normal.
Exactly. You are getting experienced in it. And so you know how to deal with it. So you go back to your first birth and you're like, okay, when I was so much of down, this was how I handled myself, and also you kind of get used to it. We call it tolerance. You get used to it. And so it doesn't really have an effect. But mind you, this is where I want us to understand that the level of severity when it comes to postpartum depression is what's important. Almost everybody gets a little bit depressed after childbirth, but the level of severity is what makes it significant. Okay, so if, for instance, on a scale of 0 to 10, you are saying the level of severity is, say, 9 for the first one. For all you know, the second one will drop. So with time, maybe the third birth, the fourth birth, you are at 1. So significantly, it doesn't really have a toll on you.
Okay. So if you don't pay attention, that is where you get that level, like.
Not the attention. You see, the truth is a hormonal issue.
Imbalance.
So you are not the one determining whether you want to be depressed or not. You are. However, the truth is, because you have gone through it again and again, you have an experience, handling it. So the level, you have it all right, but the level of severity drops and it doesn't have any toll on you.
Father, pregnancy is very serious. So people get pregnant and what they go through, the vomiting, the craving for, in fact, uncommon things that in their normal state, let me put it that way, they will even think of eating. And after child birth, then they go through postpartum depression. It's very serious.
Well, it is. It can really, You know, maybe when we get to the symptoms and behavioral symptoms, you will know that it can be really serious. It can really be serious. But the unfortunate thing is that because you have just given birth, it is not advisable to be given antidepressants. Okay, so you may have to deal with it yourself, because the moment you begin to give you antidepressants, which is psychotropic drugs, it mixes with the breast milk, and the baby will be affected. You understand? So it's very severe, very, very serious. But maybe when we get to the signs, the symptoms, we will know.
We'll go for a short commercial break. We'll be right back. Welcome back. If you are tuning in now, you are watching Health Pavilion, and we are discussing postpartum depression. Father, I want to find out, is there any difference between baby blues and postpartum depression?
I would say it is just one aspect of postpartum depression. So we take it that postpartum depression is an umbrella definition or an umbrella label. Okay. So under that umbrella, we have baby blues, we have depression, and we have psychosis. Okay, so they are all aspects of postpartum depression or manifestations of postpartum depression, but they are just aspects of them.
So what is baby blues like? The differences, or they don't have they have similarities?
Well, so let's take it this way. So the baby blues come in when your sense of low mood comes in on the sight of your baby, or your baby gets you irritated. Okay, so on the mere fact that the baby is crying, instead of you enjoying, you know, mothers are excited on hearing the first sound of their babies. But you hear the sound of your baby and you are irritated. The severest one I've seen was in one of our hospitals where somebody presented, and what she was saying was she was arrested by the police because she decided to pick the baby and hit the baby on the wall here in Ghana. Why? Because the baby was sleeping whilst breastfeeding. You understand? It gives the mother another you know, sense of irritation altogether. Okay, so baby blues, when you are blue, you know, we don't have it in our Ghanaian parlance. The word blue cannot be interpreted by any language in Ghana. Okay, but blues are where you don't feel too excited about anything. You are just numb. You don't. So either the person gets irritated or the person is indifferent to the baby. So what happens is that the baby is crying, you don't care. The baby is hungry, you don't care. If he continues crying, you get angry. Some of them will even beat their children. The extreme of it is when some of the mothers will just pick their babies and dump them in a gutter or somewhere. For all you know, it may not necessarily be because the person did not want to give birth, but it could be postpartum depression.
Oh, okay.
That is the baby blues. The second aspect, as I told you, 3 manifestations. The second one is the depression that we are talking about. You just feel on the sight of your baby, or without any provocation, you are crying, you are so much of a low mood, you want to switch off all lights, you just want to be at one corner of your room. You know, all those symptoms of depression fall under the second aspect. The third aspect is the psychosis, where you begin to either hear sounds or see sights. So you see your baby with beard and you think that your baby is too old. Or you begin to see you know, things around your baby. You begin to hear sounds that you are not supposed to hear. You know, you begin to feel God is telling you that this baby is going to be, you know, you have all the hallucinations and you begin to behave weirdly. Okay, some people will begin to talk too much. Those ones normally come right after the childbirth. Okay, they begin to talk, they become aggressive, they have hyperactivity, or they have increased energy, and they want to, even if they have, some of them may have gone through CS, and they want to get up and go home. You see, so the psychosis side of it too is there. So we have the three: the baby blues, the normal depression that is associated with it, and the psychosis. But we can't say this one is different from that. They are just manifestations. Depends on which one comes with.
And they are all serious conditions, I presume.
All of them will still fall into the range of severity, the level of severity. Normally, when you come to the clinic, we want to take the history and measure you on a scale of 0 to 10, where 0 is non-existent and 10 is extremely severe. So depending on where you are, then we know how to give you treatment.
So how do you identify somebody with postpartum depression? From what you've said so far, are there any other things we can identify a woman with postpartum depression?
On a set like this, in a studio like this, it is always not too advisable to give specifics. But I could give general things that people should be looking out for, especially spouses, family members, because I think that's the main target. Okay, so if somebody has given birth and the person is all of a sudden not expressing the joy of childbirth, behaving weirdly, talking abnormally, or talking too much, or reduced talking, the person begins to walk slower, even though the person may not have gone through CS or something that should occasion her walking slower. The person wants to always put off the light. The person will prefer darker colors for the baby rather than the bright colors that we all want. You know, the person cries abnormally, and the person always, when visitors are around, they will leave the baby with you and go to their rooms. Okay, oh, take care of the baby for me. So you would think that is normal. We can be looking out for some of these little things. But the detailed ones, it is not always advisable to talk about it on set like this. Why? Because just one aspect of it doesn't mean that you have postpartum depression. Okay, so if it is not interpreted well, the public may think that you have postpartum depression, so let's deal with you.
You need to seek
exactly, it might not help. But these are basic things that we could be looking out for.
Okay. Is there any treatment for postpartum depression? Naturally, treatment and orthodox like, is there any?
Well, there are medications for it. Okay. However, there are problems with the medications. All psychotropic drugs, all antidepressants, I should say all, are water soluble. Mix it with your fluids inside your system, your blood, the breast milk, sometimes even sweat, saliva and everything. So imagine you taking a quantity of antidepressants, which will help you boost your mood. Okay, but it mixes with your breast milk, and the baby taking it, is taking almost the same quantity of antidepressant that you, the elderly person, is. So you can imagine the effect you have on the children. So normally, even though there is medication for it, we don't normally go there, unless it is extremely severe. So if it's extremely severe, then we can find a way of managing it. But even that will restrict your breastfeeding, so that the period of time you are taking those medications, your baby may have to do some supplements for a while. Okay, but aside that, we have psychotherapy that really works. Once you avail yourself for it, we have various forms of psychotherapy that we offer, and it helps. Aside that extreme ones, we have the family support system that helps. If you get somebody who understands what it means, the person keeps you company. Okay, so the social support can help the person to go through it. Normally, it doesn't last too long. Normally, I'm not saying always, but normally it doesn't last. Say about a month or 2 years. So you can get people supporting you around that moment until it dissolves. Okay, so if it doesn't dissolve, that is when you will need professional help.
Professional help in management of the postpartum depression. So in that case, can you tell the mother not to breastfeed for a while whilst taking the antidepressants? Because we are also advocating for exclusive breastfeeding. Here lies the case, because of your condition, you have to deprive your baby from your breast milk.
Yes, you see, as I said, we have the level of severity. So with the level of severity, what happens is you may have to really deal with it with the clinical psychologist, okay? So that if it goes beyond that and the severity is so high that you may have to take medication, that is when we will request that you curtail breastfeeding just for a while. Normally, we'll just help you out with some few days, okay, just to clear you off the severity level to a milder one where therapy can take over, then you continue your breastfeeding.
Father, I was also wanting to find out about obsessive compulsive. Does it have any association with postpartum depression?
Well, it does. It depends on the manifestation of the OCD or the obsessive compulsive episode that you may be having or may be exhibiting. So if it is about intrusive thoughts where you are thinking about one side of life, you are always negatively thinking, okay, definitely when you are giving birth, it can trigger because, okay, what if I go for labor and I don't come back? So you are thinking negative. So if it is about a negative intrusive thought, which is also an OC, fair enough, it can cause. But if it is the behavioral ones, like you go and check whether your door is always closed, you go and check whether your hands are clean and all that, those may not necessarily affect, you know, your labor and is after. Okay, so we may not necessarily have a direct link, but it could be, especially if it is about thought.
Oh, okay. So the thought comes in, like when you have this thought about negative aspects, then the depression, the postpartum aspect
could trigger.
We'll go for a short commercial break. We'll be right back. Welcome back, viewers. If you are tuning in now, you are watching Health Pavilion and we are discussing postpartum depression. My guest for today is Reverend Father Anthony Efriye Amponsa. Father, can you please tell us if there's anything a pregnant woman should do before delivery?
Yes, there are things you could do to avoid or so that you don't even go near postpartum depression. One is what we call the psychoeducation. When you are expecting something, when it happens to you, it's no news and it's no longer a shock. So psychoeducation, sometimes I would suggest that our midwives and the gynecologists and the clinics that you go, and they'll be able to let you know that this can happen to you. Okay, and as you go for the antenatal care, they could, be observing and be giving you tips like live your life this way. So psychoeducation helps. I recall somebody talking about people who are most educated are less likely to have it. Yes, it's possible because I'm aware of myself, and so when my hormones are dropping, when my energy is dropping, I'm aware. So I know that I'm expecting this to happen to me, so I'm able to deal with it some way, somehow. So that could be my advocacy for all who work with maternal care, that they could be able to educate people when they come around. Another side of it is regular exercising and the type of food you eat. Okay, if you are able to exercise regularly, what happens is it triggers an aspect of the brain, and fortunately the baby's brain is also inside your womb, so it triggers an aspect of the brain that will secrete more of happy hormones inside your system, so it deals with your depressive episodes. That is, even if it will. Okay, so regular exercise, and you don't tell yourself that, oh, because I'm pregnant.
That's what I was coming to ask, because most pregnant women become lazy when you ask them to exercise, even taking a stroll, they think they are too heavy to even walk a distance.
Yes, you know, you may not necessarily have to go for a long distance walk. Just do the regular thing. If you need to just walk from the dining table to go and wash your own bowl, it's better. Okay, if you would, another clear one, you may decide maybe the latter part of your third trimester, you may want to avoid the remote control. Walk to the TV and just change channels. Okay, so the more you exercise, the more the hormones that take care of your joy mood will be secreting into your system. Okay, another side could be music.
The exercise again. Some pregnant women also have problems in during their pregnancy. So they are advised not to do vigorous or even to have complete bed rest. What about those people? Yes. That means exercise is out. It's out for them.
It's out, yes. So before you even do any exercise, normally consult your doctor. Okay. However, there are others that you can do. Listening to music. Any music at all, not necessarily religious, but anything that can excite you, do it. Watching funny clips and funny videos and all that, you know, just take your mind off it so that you trigger enough happy hormones in your system.
But too much happiness too can...
No, that is too much expectation. Oh, okay. But joy helps. Joy really helps, and it will you know, try to balance your hormones and you're able to deal with it. And also the type of foods you eat. You know, brighter foods, red and yellowish foods help. Okay, of course you will need the green and for the blood and everything, but you know, brighter foods, the melons, the oranges, you know, the mangoes, the brighter foods, you know, give you some form of, you know, natural sweetenings, and you know, it's able to help you to increase your energy naturally rather than taking the artificial ones that may cause problems for you. So food, exercising, good rest, you know, things that will excite you. These are basic things that you can...
Family, gathering, attending programs and stuff.
Anything that can excite you is good.
This is before pregnancy. So what about after delivery? What should the mother expect? Like, what should the mother do so that she doesn't go into that postpartum depression? A few weeks after their delivery, they experience that. So what should the mother do to avoid that?
Normally, what you would have to do is be very sensitive. Be aware of yourself. So the moment you are beginning to be aware of yourself, when something is going wrong with you, you would know. Okay, so like the scripture says, for lack of knowledge, my people perish. So be in control of yourself. Know yourself. That, oh, for me, I am normally quick-tempered. So if you are being quick-tempered, it's normal. But if you know yourself to be a very calm person, and all of a sudden you are getting irritated, all of a sudden then you know that, yeah, there's something wrong with me. Then you seek help. The first help could be the immediate ones around you. Tell them how you feel. Explain to them how you feel. They'll be able to understand you. Normally, the social support around us are not able to help because we don't know what you are going through. Okay, so all we know is that all of a sudden, after giving birth, you are just being naughty, you are just being aggressive, you are just being this, and they all avoid you. But if you're able to let them know how you feel, they will understand you. And if it goes beyond that, the next point is to talk to your physician or whoever, who may also refer you to a psychologist to work on you.
And what about the family? To help the pregnant woman, because normally they say pregnancy is alone, but it involves family. What should the family also do to help to avoid this postpartum depression?
Well, you can't do much, but you can help. You can only support. You can't do much. But let people, when you realize your family member is behaving weirdly, is behaving in a way that is not usual of the person, try to go closer, especially after childbirth. Okay. You may be tempted to think that, oh, you were praying for a child, now that you have it, you are proud. No, once you see that there's a change and you're a family member, you're a spouse, or you are a mother or a sister or an in-law or whatever. Once you realize that your person have changed, please go closer, because for all you know, the person may be going through that episode of life. So the support system is what we call for. You don't need to do much, but let the person know that we still support you no matter what, and it helps.
So, Father, your final word before we draw the curtains. What do you have to tell the public out there concerning postpartum depression?
So those watching me now, postpartum depression is real and it's happening to so many people, and they don't know what to do. All that I will tell you is be aware of yourself, know who you are. And so when things are changing, your moods are changing, you will know. So when you know, deal with it by doing your regular sleep well, your exercising, your eating well and everything. If it's not helping, talk to somebody about it. It doesn't mean you have to really see a professional. Talk to those around you, your husband, your in-laws, your friends around you, so that they're able to support you. But if it goes beyond it, there's always help for you. You can always walk to any general hospital, or you can come to any of our centers that offer psychological help, and there'll be help for you. It is not the end of the road. Just stay strong. Take care of the children for us. They are our future.
Stay strong and take care of the children for us. They are our future. That's coming from Reverend Father Anthony Efriye Amponsa. Father, thank you very much for this wonderful education. Hope to see you next time on Health Pavilion. So viewers, please stay strong for me and stay healthy. Join me same time on Health Pavilion. Bye-bye.